Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis. We give credit to Professors Stephanie Lucas and Terry Wahalik for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Today, we welcome 5 students from the pharmacy school with a podcast entitled Dose of Knowledge, A Pharmacist's Impact on Patient Lives, All That Is Seen and Unseen.
A mom comes to the pharmacy to fill her child's prescription but learns the dose is unsafe for her child. A new drug gets FDA approval.
A patient with Hep C receives the medication he needs to cure his disease.
Another patient's life is saved. So who makes this all possible? I'm Anne, and I'm joined by Ira, Melissa, Zara, and Zoe. We are pharmacy students from the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy. Together, let's explore the world of a pharmacist in today's episode of A Pharmacist's Impact on Patient Lives, All That Is Seen and Unseen. So our podcast is part of a larger series called Dose of Knowledge, so make sure to go check out the other podcasts after this. But in today's episode, we will talk about how pharmacists impact patient lives, specifically focusing on their work with drug overdose and substance abuse.
But let's first talk about some of the general ways a pharmacist impacts patient lives. A pharmacist is really involved in every step of the medication process, from the earliest stages of drug discovery as new and better drugs are created to fight disease. A pharmacist has patient safety as a central focus. Your pharmacist is guiding the research, making sure medications are not only effective and work the way they're intended, but that they're safe and that they don't cause any harm.
Right. And so then once they're approved, your pharmacist can just work on dispensing the medication, such as starting with double checking the prescription and catching any of the errors that they might see on the medication before it ever crosses the counter.
And after the medication is dispensed, the pharmacist makes sure, do the patients understand their medications, why they're taking them, how to take them, what should they be concerned about, or do they even have the resources they need to take the meds? What a great partner for patients to have in the medical field. In fact, the pharmacist is often considered the most accessible provider in the healthcare team. Did you know that a pharmacist can be seen just by calling or showing up to a pharmacy at any time? And the pharmacist may not have an immediate answer to a patient's question or needs, but they certainly know how to get them. The pharmacist keeps the patient safe, and they are a trusted, reliable, and really a valuable resource.
Absolutely. Oh, and beyond individual patients, we also see that pharmacists are out there advocating for different policies and laws that can help better protect and support their patients. They make big changes in the lives of patients and in the healthcare system as well. You can often see them organize vaccination clinics and health drives, as well as providing education and offering free screenings to patients to better promote their mission and goal.
You know, no matter what specialty or what role a pharmacist assumes, there's always one common theme. A pharmacist impacts and saves lives. There are endless moments that a pharmacist has an impact on their lives of patients. Today, we will focus on a pharmacist's role in a current challenge, the opioid crisis. According to the CDC, the U.S. Centers for Disease Control and Prevention, drug overdoses have dramatically increased over the last 2 decades. In fact, in 2020, a 500% increase was seen from the year prior. 500%. That year, 92,000 people died from drug overdoses, and about 3/4 of those patients were overdosed from a prescription or illicit opioid. Now we will tell a story and share insights along the way from both Dr. Bart Coleman, a local provider in our community, and Dr. Amy Teamer, a director and associate professor at the St. Louis College of Pharmacy. We will specifically focus on pharmacists and opportunities for harm reduction in opioid use.
In today's episode, we will be following the life of Liam. Liam is a 16-year-old sophomore in high school. Last week, he went to the pharmacy with his mother to pick up her new prescription medication. His mother was recently prescribed an opioid called oxycodone.
as a pain reliever since his mother had just recently gone a knee surgery.
There is something that I would like to share that I discovered the other day after talking to Dr. T. Meyer, because I am a very curious person and I wanted to learn how impactful pharmacists are. So according to IUM, which is like an Institute of Medicine committee, what they do is they give advices on current healthcare quality status in United States. So according to them, medical errors can also be one of the leading causes of death, which implies to me that pharmacists play such a huge role in making sure that medicines we receive are appropriate or that we're not dispensed with the wrong medicine instead. They review prescriptions, ensure the appropriate drugs, dose, instructions are provided. They watch out for any allergies or see if there are other current drugs that might interact with the patient's prescription. So there are also some medicines that like sound or look alike. One good example I can really think of right now is Adderall versus Inderol. These are two completely different medicines. So also in harm reduction efforts for people who inject drugs, pharmacists are involved in needle exchange programs where they distribute clean needles to prevent the spread of infectious diseases such as HIV and hepatitis. They provide information about treatment options as well for substance use disorder, which is a rising concern these days. So I do appreciate the amount of work and focus pharmacists put in making sure that the patient is having the right medicine. Pharmacists help in safe injection and needle practices before dispensing. So they make sure that needles, syringes are clean and ready to be dispensed.
Yeah. So, so that all leads up to the patient being at the counter and the medication being prepared and ready for them. And so now, when it's time to hand over that medication, maybe an opioid, to the patient, we have to make sure that the patient knows how to take it. And so that's what we would call counseling. It's turning, the information on the medication package with all its jargon into something that the patient can use as instructions to know whether or not the medication can be split or chewed, how to avoid eating or drinking things that would interact with the drug, how do they avoid addiction with their opioids, and do they know that addiction is a risk with all opioids, not just the ones off the street. Now it's up to the pharmacist to explain all these things. And that's, counseling is so important to the practice of pharmacy. A patient might not see the doctor again for maybe even a year, but they see their pharmacist every month when they pick up their prescriptions. And for really pressing issues, your local pharmacist is almost always just one phone call away. Some pharmacies are even open for 24 hours a day. It doesn't end at prescription medications like opioids either. For example, the opioid overdose medication Narcan was recently approved for sale over the counter by pharmacists in Missouri, which is wonderful. And this is a life-saving medication, but it can be very complicated to use because it's a nasal spray and it's used in emergency situations. So you have to be ready and prepared. So what's wonderful about this is that pharmacists can see that the patient has an opioid prescription and recommend this Narcan, which will stop an overdose from happening, and then counsel the patients right away on how to use it and counsel their family members, most importantly, on how to use it. Sometimes counseling also involves finding out whether the patient would benefit more from another medication, some other pain reliever, and giving them the tools to determine that for themselves.
While picking up the new medication, Liam and his mother got the chance to speak with the pharmacist to learn about the correct way to take oxycodone and the importance of following the dosing instructions listed on the bottle. In addition, they learned about the signs and risk factors of opioid overdose. At the end of their visit, the pharmacist explained the importance of a medication called Narcan. Liam learned that Narcan is an over-the-counter medication that can be used in emergency to rapidly reverse an opioid overdose. The pharmacist explained to Liam and his mother the importance of having Narcan on hand and showed them step by step how to administer the Narcan nasal spray.
Do you all know that pharmacists also play a significant role in alternative options for helping out people with their drug overdose problems besides just dispensing medicines? Because when I was in high school, all I knew was that the pharmacist's role was just dispensing medicine. But talking to Dr. Team Iyer, who is herself a pharmacist, helped me understand that pharmacists also have a role in suggesting alternative treatment options. They work in healthcare teams that comprise so many other healthcare professionals, such as doctors, nurses, physical therapists, dietitians, mental health professionals, and many more. So they can work with them to make specific plans for their patients or even refer them. And there could be a lot of things they can work on, be it exercise plan, be it making nutrition intake plan, practicing mindfulness, or helping out with acupuncture, doing substance use screenings. And these screenings are basically a questionnaire that help the healthcare professionals actually to get a better understanding of their patient's concern or issue. So definitely talking to her helped me understand that it is important for the pharmacist to make sure that they not just treat symptoms, but also do their best to heal people using their resources.
Hiram, you bring up some really great points. I can't help but wonder, with Liam's mom, had she even been given these other ways to try to treat her pain first? Dr. Bart Coleman shared recently some of his insights that there seems to be this great willingness to prescribe high doses of some of the strongest pain medications, such as oxycodone or fentanyl, without trying first-line medicines. And patients are missing the opportunity to take lower dose medicines or less severe medicines, such as Tylenol, or medicines like ibuprofen, which can have an effect in helping the healing process as well as relieving pain. Patients aren't getting ways to treat their pain first, such as acupuncture or ice, therapy, nutrition, exercise, or even addressing the emotional and mental well-being of our patients. There's certainly some more that we can do for our patients. And I agree with you, pharmacists can have that impact on patients to provide this education so that they can supplement or even completely replace the medicines that they've been given.
And that's exactly what went wrong. Liam's mom was in fact not given recommendations for other ways to treat her pain. As her pain worsened, she required more and more medicine, which became less effective as her body got used to it. She started to take too much without realizing the dangers. When Liam came home from school, he was shocked to find his mother unconscious on her bedroom floor. He could see that she was barely breathing and would not respond to him. As Liam began to process what had happened to his mother, he started to realize that the symptoms his mother was experiencing were very similar to the symptoms the pharmacist had stated when talking about opioid overdose. Realizing his mother had just overdosed, Liam immediately called 911 and ran to retrieve the Narcan the pharmacist had provided them. Since he was present the day the pharmacist was teaching how to properly administer Narcan, Liam was able to take matters into his own hands and administer the Narcan to his mother both safely and effectively. Later that day, when Liam got the chance to talk with the nurses in the ER, he was informed that if he had not found his mother in time and administered the Narcan, his mother would have died. In that moment, Liam realized the severity of what had just happened and was truly thankful that he had the proper knowledge that allowed him to help save his mother's life. Had Liam not been present the day he and his mother picked up the opioid medication, Liam would have never known any of the signs or symptoms of opioid overdose and would have never known how to administer Narcan. It was through the pharmacist's impactful counseling that made Liam realize how dangerous opioid overdose can truly be. Liam had never realized that he, as a high schooler, could play a role in saving someone's life, let alone his own mother.
Oh, thank goodness this worked out. What a great save.
Yeah, I completely agree. That's such a very powerful story. I like so far how we've been discussing about the different pharmacist roles in like monitoring the medication and counseling the patient. On that note, I just want to take a moment to talk about how pharmacists can also like help shape our thinking about that opioid use disorder is just not a choice, but it's also a serious condition. There's so many changes that goes on in a patient's like mind and like pathways, things like that, when like they become more dependent and reliant on these medications. So pharmacists are really like in the forefront of that, like promoting and, trying to advocate for this. There's one interesting study though that I found about pharmacy and pharmacists overall is that I'll quote this, is that they provide great support for these patients because they offer them a safe and accessible treatment starting point in the pharmacy setting. I'll just have a link of the study down in the below for you if you want to reference it. But also from a conversation with Dr. T. Meyer that we had, I also realized that it's very empowering how pharmacists are able to meet the patient where they are at and respond to them accordingly based on how they, if they're ready to change or if they're a bit reluctant to. So, for example, if the patient feels that they're ready to address their condition or their concerns, the pharmacist is always there with open hands, ready to help them with any treatment and getting them to the road of recovery. However, if the patient doesn't feel ready and is not ready to make that next step, the pharmacist can still counsel patients on how to use the medication safely, such as the opioids, counseling them on using Narcan and clean needles if they need to in very dire situations. So I know that this is like a very major shift in the way that we all think about it. It's very new, but pharmacists are really the great experts at showing empathy to their patients. And they help to identify these barriers that the patient might, encounter and helping to understand and respect their decisions along the way and ultimately offering them the best solution that they can for them at that moment. So I also wanted to say that in the story that we have been saying, the empathy also extends to the friends and family members, such as Liam himself. And so the pharmacists are great at creating and maintaining those strong relationships with not only the patient, but their support system around them. And so I'd say pharmacists are the major advocates of trying to destigmatize these negative attitudes, kind of misconceptions about people who are facing opioid use disorders. So.
Yes, and the CDC agrees with you and Dr. T. Meyer. Addiction is a long-term disease, and reducing stigma is a key priority set out by the CDC, which makes sense because stigma prevents people from seeking the help that they need, especially regarding substance use. Pharmacists really are in the center of their community. They're trusted resources and advocates for their patients.
Yeah, I completely agree. Pharmacists really are one of the major advocates in their community for the health of their community. And speaking of advocacy, like we were talking about earlier with Narcan, as of 2017, pharmacists can dispense naloxone, also known as Narcan, without a prescription from a physician in Missouri, which really puts them at the front lines of preventing drug abuse and death from drug abuse. For listeners who don't know what naloxone or Narcan is, it's this awesome medication that can stop an overdose from opioids like heroin or fentanyl. Naloxone will not harm someone who is not overdosing, and it's pretty easy to use, although it is a nasal spray. But for a long time, you couldn't get it without a prescription, and a lot of people had a hard time asking for it in the doctor's office. And one of the catches of Narcan is that if you are the one overdosing, it's very hard to give yourself Narcan. Usually it has to be a family member who, one, has it, and two, knows how to use it. But if those two conditions are met, it's a wonderful life-saving medicine. And so now it's awesome because your pharmacist can identify people who need to have Narcan on hand and teach them how to use it without them ever having to go to a third location and, put themselves in a position that they might be uncomfortable with. And so we really did a good job in the realm of pharmacy, finally kind of rallying and saying like, hey, patients need this and it shouldn't be so hard to get. Not everyone was on board with this. There were some concerns about making it more easily accessible, but in the end, the argument that harm reduction comes first, and we need to be meeting patients where they're at in order to keep them alive, really, in the end was pretty compelling. Patients cannot get better if they do not live through their overdose. And that is the power of advocacy. When providers and experts in these medications get together and advocate for patient access, things get done. And that's maybe one of the parts of pharmacy that you're less likely to see if you're just picking up a medication. But advocacy is just as much a part of being a pharmacist as dispensing medication. And also part of that is their involvement in the community as educators too.
Zoe, you brought up great points on also seeing there's this huge emphasis on education in the community, whether it's at prisons or emergency medical service providers, at schools, supporting programs such as One Pill Can Kill, or just educating on overdose and the correct use of naloxone. And yet another way, pharmacists have this great impact as they helped create a system of monitoring and controlling narcotic prescription drugs. Did you know that prescription drug monitoring program was only recently implemented in 2021 in the state of Missouri? And now with this program, pharmacists can impact patient lives as they're able to monitor the use of the opioids. And that ensures safe and effective pain management while minimizing harm such as addiction and overdose.
All in all, pharmacists impact and save patient lives. Whether it is through patient education, advocating for patients, or catching medication errors, pharmacists are working in ways both seen and unseen to provide the utmost care to patients. With the rise in opioid overdose deaths in the United States, pharmacists play a key role in prevention of substance abuse through the education that they provide to their patients. We hope you were able to gain some knowledge on the role of pharmacists in substance abuse prevention and urge you all to educate yourselves on how you can play a role in opioid overdose prevention.
And I just wanted to share that I'm immensely proud of the pharmacy profession, and I feel so thankful and excited that I'm on the path to become a pharmacist. There's so much more we can do. Do you want to be a pharmacist and impact patient lives? Go to uhsp.edu or just visit your local pharmacist today.
I'm Ann Nguyen, and I want to be a pharmacist to impact and save patient lives. I am Ira Mahyoti, and I want to be a pharmacist to impact and save patient lives.
I am Melissa Lichtenberger, and I want to be a pharmacist and impact patient lives.
I am Zara Ali, and I want to be a pharmacist to impact and save patient lives.
I am Zoe Venable, and I want to be a pharmacist to impact and save patient lives.
Thank you, pharmacy students, for hosting the podcast today, and thanks to our listeners for joining us. Please share this episode with your friends and social media outlets, and seek out the other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcasting channel.